Good morning all. I am Mrs. Deepikashree from the Department of Physician Assistant at the College of SNS Science, SNS Allied Health Sciences. For pancreatitis, already we saw the video from introduction to the pancreatectomy procedure. In this video, we are seeing about the surgical procedures of pancreatectomy. So for the procedure, this is the pancreas that is inflamed due to some of the reason. Already we saw that. For that, the inflamed part is removed, so only the distal part is removed, so that pancreatectomy is removed as distal pancreatectomy. The distal pancreatectomy of the distal part of the pancreas is the body and tail. Distal means distance and far apart from the center. The distal pancreatectomy removes the tail of the pancreas and sometimes the body if that involves too. The tail of the pancreas is closely connected to the spleen. The distal pancreatectomy often involves removing the spleen along with the tail of the pancreas. This is called distal pancreatectomy. So this is the diagram. In this picture we have the distal part, and another picture that is this is after surgery. In this part we don't able to see the distal part because it is removed. So this is one procedure. And another type of central pancreatectomy, that is the central pancreatectomy is the center part alone removed. The central pancreatectomy removed the central body of the pancreas, leaving the head tail intact. The difficult operation is rarely indicated. It's only practical if you are removing something locally, but when possible it can help preserve more of the pancreatic function and prevents need for additional organ removal. This is the central pancreatectomy. This is the center part of the pancreas, so that alone will be removed. The another one is pancreatic duodenectomy, that is the Wills procedure. The pancreatic duodenectomy, that is a pancreatic duodenectomy removes the head of the pancreas along with the part of the small intestine that connects to it, the duodenum, because the common bile duct also runs through the head of the pancreas and drain into the duodenum. The bile duct and gallbladder also removed. The Whipple procedure concludes by reattaching the remaining pancreas, bile duct and stomach to the remaining small intestine so that digestion can continue normally. So this is the Whipple's procedure. So in the Whipple's procedures, this is the before procedure. The bile duct is connected and the pancreatic duodenectomy, which is attached to the duodenum, the head of the pancreas that is affected. In the other picture, the removing of the duodenum part, and it is attached to the intestine because for the proper digestion. So this is the Whipple procedure. The head of the pancreas will be removed. The another one is total pancreatectomy. The total pancreatectomy removes the entire pancreas when the whole organ is affected by the disease or when there is not enough healthy tissue left to preserve. Removing the whole pancreas also involving removing several other organ, vessels and lymph nodes surrounding it. Typically that includes the spleen, gallbladder, duodenum and the lower part of the stomach. The operation then reconnects the stomach and the bile duct to the small intestine. After the removal of this part, the stomach and the bile duct is connected to the small intestine. So this is the before procedure. This part is affected. After that, the head part and the middle part also removed, and it is directly connected to the small intestine. So this is the total pancreatectomy. So the total pancreas is removed. So the connection is anastomosis to duodenectomy. So in this video we saw about the total pancreatectomy, Whipple procedure, that is also known as pancreatoduodenectomy, and central pancreatectomy and the distal pancreatectomy. So these are the procedures for the pancreatitis patient.